Hi, I'm Jackie Sellers, an educator with the Institute of Integrative Oncology, an educational division of Greet the Day. Today we're going to be reviewing the foot and hand massage that you as Chemo Comfort Touch volunteers provide for our patients in the infusion centers. Today we're going to start with the foot massage. So we've taken the shoes off of our patient and we've put them next to the chair. They're not under the chair because if you put them under the chair and they get out of the chair, it will be swallowed by the chair. You all know that. So it's out of the way of any of the nurses. They have access to the pole, IV pole. So the first thing is to get the blue chuck underneath their feet. You've thoroughly washed your hands and you come back. Now, some of the chucks have a plastic part on one side and a nice fluffy part, and that's the part you want them to feel. Some chucks are very large, like this one, and some are small. So I'm going to cut this one in half, and here's how I'm going to do it. I'm just going to very gently pick up her leg and put that side under, and then very gently pick up this side. And now the chair is nice and covered. So we start by saying hello. And the hello is over the sheets, or if they don't have a sheet or blanket on, just over their pants. And we start up here at stomach 36. And what we're using is the weightless therapeutic holds. No compressions, not even gentle ones. And we're just making contact with our patient, saying hello with our hands, not necessarily with our voices. And we do this 3 times, and it's very gentle and very slow. So once I'm down here at the toes, I just bring my hands right back up here to stomach 36, which is one of our acupressure points for nausea control. And do you see how I'm just gliding down the leg? I'm not massaging anything, and I'm not coming off and then replacing. I'm starting here and then I'm gliding to the next spot. And it's just a nice way for you to get centered, for you to get your intention ready for that patient, whatever it might be for that day. If they seem particularly anxious, you can think about being calm. If they seem like they're really upset, you can just give them some love. So now we're on the 3rd pass. And we're just setting the tone. And then we come to the toes. Now we undrape one leg. We're going to keep the other leg draped because it might be chilly in the infusion center. It often is chilly. Now, it's not the summertime, it's winter, so they have pants on. So now you're going to have to bring the pant leg up. And you want to do this as gently and as carefully as you can without messing around with it too much. Just up to the knee. You don't have to go any further than that. And you're just going to take a look and see what's the condition of the skin. Is it okay? Are there any open sores? If there are, we're not going to massage there. But her skin looks great, so we're going to start the massage. You have a little bit of lotion, not a whole lot. You're going to put it in this hand. Your hand is in contact, and you're just going to let it warm up a bit. Everything we do in the infusion center is slow and calm and light. So when we start out, we get our lotion nice and warm, and then we do our 7 to 8 strokes up toward the knee, strokes only in the direction of the heart. No pullback. Nice relaxed hands. You don't have to have flying fingers, just keep your hands relaxed. And I'm not going very fast. And you see I'm doing the little train here so that one hand is always in contact with my patient. And this is just a nice way to get their legs moisturized. One of the side effects of chemo is dry skin. So this is going to be really helpful for them. Okay, so we're done with that. And you probably have enough lotion on your hands, so you're just going to come down to the foot and get the foot lotioned up. If you need to, you can reapply some lotion. So I like to just get the foot all lotioned up, and then I like to start with circles around the malleoli, or otherwise known as the ankle bones. I'm moving very slowly. Another way you could do this is kind of with the palms of your hands and just kind of do these circles this way. This is, the pressure level is light lotioning, meaning we're not moving any muscle or skin. And that's what we were using when we did our 7 to 8 strokes up the leg. It's light lotioning. Now, if their skin seems like it's good and we can do a little bit more, we can do gentle massage, which is just the next pressure level up. And at that point, then we're moving a little skin, we're moving just a little bit of muscle underneath. And you see how I'm going over the top of the foot? This is lovely. They just love this. This feels so good. And if you go back here, behind the ankle bones, and on the inside is the acupressure point K3. K3 is great for anxiety and for nausea. This area right here at the top of the ankle and down and in front of the ankle bones is our reflexology area for the inguinal lymph nodes. So if we just give these a few strokes right here, that works. And I'm always keeping in contact. Now, if we go along the outside of the foot, the lateral aspect of the foot, we're going to hit the legs, the arms, and then down here, the low back. And if we're on the inside, on the medial aspect of the foot, right on the edge, we're doing the entire spinal column. The entire spinal column. We can do a little soft fist on the bottom of the foot. The soft fist is just this. Now you see that there's some black stuff on there. That's because, you know, they had some black socks on or something. Don't worry about it, it's okay. This is what happens in the infusion center. It might be that when you take their socks off, lots of skin flakes off. Chemo makes skin very, very dry, so don't worry about it. Okay, so that soft fist is just, it can be a light lotioning motion, or it can be gentle massage on the bottom of the foot. Now, some other reflexology points are right in here in the web at the base of the toes and on the back of the toes as well. These are our cervical lymph nodes. This is a great place to give a little extra attention to. For most people, these are not compromised, so if we can access a point that isn't compromised, an area that isn't compromised, and help it out with a little massage, that's a good thing. So 1, 2, 3, 4, 5, these are the cervical lymph nodes. Now the axilla is right here on the bottom and on the top, right under the little toe, right under the ball of the foot, in that nice soft area on the bottom And if you just do little circles here, now you're going to be stimulating the axillary lymph nodes. We're still using a light lotioning pressure or gentle massage pressure, either one. Okay, so I wanted to point out a few reflexology and acupressure points on the bottom of the foot. So remember when we talked about the cervical lymph nodes and we were on the top of the foot? Well, here's the corresponding part on the bottom. It's right at the base of the toes, at the webbing in between the toes. So it's just this little area. So you hit it when you're just like using your thumb and your forefinger. You're hitting it both at the same time. The axillary area is right here. It's in this little soft part under the toe, right under the ball of the foot. And then what you're going to do is do the top and the bottom together. Gentle little circles, or you can just even hold it if it seems like that's more appropriate. So those are your two lymphatic reflexology points. Remember that acupressure points and reflexology positions might be different. For example, kidney 1 acupressure point is right here in the very middle of the foot, but the kidney reflexology is going to be down in this area. Same thing for this foot, kidney 1, and then your kidney reflexology point's going to be down here. Now, two really important organs, especially for people undergoing chemotherapy, are the liver and the spleen. The liver, which in traditional Chinese medicine is called the general, meaning everything has to get through the general. So on our right foot, the general is under the fourth toe, underneath the ball of the foot, underneath that diaphragm point, and then right in this area. So if you just take your thumb and lightly press it, you're going to be okay. The liver on this foot is a little bit over here, still under the ball of the foot, under the big toe. The spleen, which is our major lymphatic organ, is under the fourth toe on the left foot, under the ball of the foot. And then on this foot, on the right foot, it's underneath the big toe, under the ball. All of these points are in this nice little soft part. So those are two major organs that are always good to hit. Now let me show you what that soft fist looks like. Your hand is kind of like this, and you're just rolling it up and down. Up and down. For those of you who are community volunteers and you've not really had massage training, be careful that you don't do this. That's called petting. So you actually need to go back and forth. Keep in contact with your patient. And also this. Remember this? This is our spinal column all the way up and down the medial aspect of the foot, the interior. And we talked about K3, which is behind the ankle bone and on the inside of the foot. That's great for someone who might be a little bit anxious. It's a very calming point. Now, when you get to the toes, maybe you need to add a little extra lotion because they've soaked it all up. But you want to give each toe some attention, however you do that. Can be this, going back and forth. If you remember, there's the pituitary gland on the bottom of the big toe, so we can give that a little bit of love. And then my favorite thing to do for the toes is the Tootsie Roll. Just roll those little tootsies and then pull off. All of this is very, very gentle. Now, if they have neuropathy, they may not be able to handle any kind of massage, but we can always offer it. And if they're unsure, you can say, I can always stop if it doesn't feel good. My experience is that they generally love it. So then we're going to do a crisscross pattern along the bottom of the foot, and it's going to kind of go like this all the way down the foot. Just nice and easy. And then just kind of cup the heel. Give it some pressure with your fingertips. And then you come back. You can also do the little squeeze, either called milking or breaking of bread. Some people call it that. Where you're just getting under there with your fingers on the bottom like this. So you've finished this foot, and now you're just going to kind of glide up. You're going to re-drape this leg after you've pulled the pants leg down. Re-drape that leg. You're going to undrape the second leg, and then you'll start with the same thing with this leg. Let's say we've already done all that, and now we're done with this leg. We re-drape both legs, and now we say goodbye, which is just like our hello, but it's shorter. So we do this. We start up at stomach 36 again with our weightless holds. And we just slowly go down. And as I said, we only do this once. It's a nice way to just end everything. And then you look at your client, your patient, and you say thank you. And if they're asleep, then you just quietly leave. If they're awake, you can ask, you know, do you want your shoes back on? Should I help you on with your shoes? Or most of the time they say, no, just leave them off. So, in terms of timing, the hello is about 4 minutes long. That's 3 of these kinds of things. Then there's maybe 7 minutes per leg and foot for your massage portion. And then a couple of minutes saying goodbye. And then you have your 15 to 20 minute foot massage. So now we're going to do the hand massage. And one of the challenges with the hand massage is positioning yourself and positioning the client. So there are 2 positions. One is with the arm on the armrest, and one is with the arm on a pillow. First, we're going to do the armrest. So when their hand and arm is on the armrest, we want to put the blue chuck underneath so that we protect the chair. Now, let's say you're at an infusion center where you don't have chucks. We're going to take this out, and then what you use are the ever-present paper towels, because they will always have paper towels. So I will place one under, and I make sure it goes beyond the elbow, and then I'll place another one here. So that's how that looks. Positioning yourself, you're going to have to be at an angle to the chair. Their feet are going to be in the down position because there's no way to get to them. This is where you might have to remain very flexible, because if the nurse needs to get to the IV pole and you're on that corner, then you might have to just scoot out of the way for a minute. Okay, so with the hand massage, remember that if we have medical devices, our working guidelines are, let's say there's an IV right here. The working guidelines are 3 to 4 inches from that medical device. We never massage over a medical device, and we never massage over the flexible tubing that you might see. This also is true for PICC lines. So IV, PICC lines, during the hand massage. Those are the things you're going to come across. If that's the case, and you see that 3 to 4 inches is right here, essentially you're just going to do a hand massage. And you're going to do a very gentle hand massage on the arm with the medical device, because that is our DVT risk, our blood clot risk. So let's pretend that there's an IV in this arm right here. So our working guidelines were 3 to 4 inches away. So now we're just going to work with the hand. We're going to say hello, but we're just going to say hello right here. Or even better, we can put our hand under here, which will then access P6, our anti-nausea acupressure point. And remember that P6 is 3 fingers down, their finger widths down from the crease of the wrist, and it's right here. You don't have to be directly on it. If you're just doing this, you're going to be accessing P6. Remember that P6 is our most researched acupressure point and is probably the best track record for easing and helping nausea. So if you have your hand like this, you're still away from the medical device, but you're underneath here accessing P6. And then you're going to say hello. Our hand massage protocol is very similar to the foot massage. We always start out by saying hello with gentle holds, weightless touch. You can also do this. Anything that is comforting to them. And you know what that's like. You know what to do to comfort somebody. So then, if you want, you can come out from underneath here. You can do the breaking of bread thing or the milking. The only caution I want to give you on this is check out the condition of their skin. The skin on the hand is usually very, very thin, and for chemo patients can be very dry and even tear easily. If you take a visual of that and say to yourself, well, it doesn't look very good, then all you're going to do are the therapeutic holds, the weightless holds for that hand. It's the same as our DVT protocol. If we have someone who's got a DVT, then we do therapeutic holds only, nothing circulatory, no compressions, not even gentle ones. Okay, so now, magically, this arm has no medical device. It's now completely free of medical devices. The skin is healthy and pretty intact. So now we're going to show the full hand massage. Because we can, we're going to go up here to the top of the forearm and we're going to say hello. And the way we do that is the same way we did with the foot massage. And you might have to just rearrange your hands in different positions. Don't be uncomfortable doing this. Make sure your hands are nice and relaxed, very soft hands. And once again, you're going to say hello 3 times. You can even do it like this. This is where you set your intent. Your intention to bring a calm, healing presence to your patient for that 15 or 20 minutes. So you've done that 3 times. And if the skin is viable and not going to be too hard, you're going to take your lotion. You're going to slowly warm it up. You might even hold it a bit. Slowly warm it up. I may have gotten too much lotion here. We'll find out in a minute. It's one thing to think about when you're doing the arms. So then you start your strokes up the arm in the direction of the heart only, no pullback. No pullback, massage therapists. This one's tough for us at first. We're so used to doing the pullback. We're going in the direction of the heart only, because if they are at risk for lymphedema, this is safe for them. We're also using what is called light lotioning. Just enough to get the lotion on the skin, but we're not actually moving the skin. So you do that, your 7 to 8 strokes. And now what we've done is we've moisturized their arm and they're ready for their hand massage. And now it's just a really nice way to get that started. So then I like to do the milking thing. Maybe my thumbs are going around the wrist a bit. I like to run up the tracks of the hand. You're going to be very, very light. Everything we do is going to be light lotioning. It might never even get to gentle massage on the hands. So we've gone over the top of the hand. You're going to do each finger, and you're going to give each finger and each joint of each finger some extra attention. Maybe you're going to go in here and hit this little acupressure point, large intestine 4, which can be a great pain reliever. It can also calm. And then each digit gets their own special time. The hand massage usually doesn't last quite as long as the foot massage because we just don't have as much real estate. So then we're done with that thumb. And then you're going to do that to each finger. Maybe you do a little bit of twisting, just very, very gentle. Remember that their hands, especially if they're elderly, are going to be very, very sensitive. If they have neuropathy, they may say that they can't stand any touch on it, and then you say, well, would you be willing for me to try just a hold? And then if they're okay with that, then maybe you can try this. The other thing I like to do with the hand massage is sometimes I don't use any lotion at all. I just do what I'm doing now with no lotion. Sometimes that's easier, and that's fine. You don't need a lot of lotion. And now we're down to the little pinky. A little bit of range of motion there for the joint. Now, if it seems like it's comfortable and they can do it comfortably, you can turn the hand over and then you can do some nice work on the palm and then at the base of each finger in that little web. This all feels very nice, very relaxing. Your movements are slow. Your pressure is light. Both of those things activate our parasympathetic nervous system, which will then relax someone. And if you're a patient receiving chemo, you're certainly going to need to be relaxed. So we're done with our hand massage. So we say goodbye. Now sometimes I'll just keep my hand here, and now I'm accessing P6 under here, and I'll just say goodbye going up here. And then I thank my client and I remove the paper towels or the blue chuck, and I move over to the other arm. Okay, so once we're finished with this arm, we're going to take out this, and we can just put their arm back down in their lap, and then we have to swoop around without hitting their feet and without running into anybody else, and then place yourself straddled at the corner again, and then you get to work on the second arm. So another way to position the arms is by having a pillow in their lap and then having both arms resting on the pillow. What this can do is put the shoulder into a much more relaxed position than maybe it would be if they're on the arm rest. And my personal favorite is this position. And you don't have to worry about putting blue chucks or anything underneath. We'll just do it with the pillowcase as it is. So the same thing will be true. We'll be saying hello, and you're kind of positioned at an angle to the chair where you're straddling the chair, essentially, sitting on your stool. And if you want, you can slip one hand under. Remember, fingers are loose. You don't want any harsh movements. Fingers are loose, but you're still accessing P6 underneath there, and you can say hello. And you want to do this in a really relaxed position. So if this doesn't feel right, maybe you need to do it like this. And you're still accessing P6, but you can say hello like this. And you see, I mean, like I said, there's not a lot of real estate here, so it's okay. We're just going to do shorter space. And then you'll move down to the hand, and you can do your whole hand massage, right like this. They're well supported with the pillow underneath. And we do the fingers just like I did before. And if we can, we turn the hand over and we can work on the hand. But their elbow is nice and supported. They're not having to hold up their arm in any way. Now, another thing that you might have to be aware of when you're doing the hand and the arm massage is they might have one of those little hospital bands. They might have bracelets. We just work around that. We don't want them to have to go to all the trouble of taking all their jewelry off. Or if they have a hospital band, we can't take that off anyway. So whatever you have presented to you, work around it in a very calm, relaxing manner. No need to make any big deal about it. Okay, so that's how you do the hand massage with the pillow. You'll still have to swing over to the other side to get to the other arm, just like you did to get to the other arm in the armrest. So we need to go over the DVT protocol for the hands and for the legs because they're different. So if you have a DVT that you've been told about in one arm, on that arm you do therapeutic holds only, no circulatory work, no compressions, not even gentle ones. But on the other arm, you can do your regular massage. That's for the arms. For the legs, let's say the nurses said they have a DVT in their left leg. Well, the DVT protocol goes for both legs. So that's no circulatory work, no compressions, not even gentle ones, therapeutic holds only. The weightless touch of the therapeutic hold. And you can do that for 15 minutes and it will be very, very effective and very relaxing. I've had many people tell me that they feel great after that DVT protocol. Thanks for joining me today. I hope this helped in your review of the hand and foot massage for Chemo Comfort Touch. And I know that the patients appreciate what you do, and so do I.